Hello, hello, hello. How are you guys doing? Good sized group. I'm glad you all are here. How many of you guys already have an Empower? Nice. How many of you guys have an Apex? Very good, very good. So these type of meetings, these type of breakouts are more so for us to kind of share our experience. So I'm going to go first and speak a little bit about sexual medicine and wellness with the Empower. Then Nikki's going to go and speak more about candidacies. I mean, who's the best patients for all the different modalities on Empower. And then Dr. Ben, which we haven't laid eyes on yet, but he's in the building. He's going to speak on Apex. At the end of that, we're going to all sit down and take question and answers. So I think it's going to be really nice. Nikki's a lot like myself. We're both very passionate about this platform. So hopefully we can get that across to you guys. And I'm interested to hear all the questions, because I know you guys all have one. So let's get started. Okay, who said that sex wasn't important? Any of you guys agree with that? Exactly, sex is. The problem is that I remember going back, all the way back to elementary, when we talked about sexual health, we talked about disease, right? STIs is what we were talking about with sexual health. No one ever talked about what the importance overall about sex is. You know, are we all really, I mean, it's at our primal function to reproduce? Does that mean we have a portion of our brain that's driven towards sex? Does it mean that sex is something that heals us? And the truth is, yes, about all those things. People that are sexually not healthy are more likely to have heart disease, depression, anxiety, metabolic syndrome, and all those things. So back when I was just a regular old OBGYN, it was almost impossible for me to really find a solution when someone came in and said, "Hey doc, I lost sensation. I either had a knife or some estrogen." "Hey doc, my libido is gone." Well, you're gonna have to fake it till you make it. It's basically all we had back then. It's insane. But whenever, we had 5 minutes per patient, and we had to be the Jedi to make it feel like you weren't rushing them because you were seeing 60 patients in a day. So when that question came up, it was like, oh shit, swallow me. I have no idea. Well, guess what? With the Empower, we have answers for almost every single one of those things. And the cool thing is that I finally believe that I'm a way better doctor now than I was when I was seeing those 60 patients a day. So I'd like to share a little bit about that. So what is it about our approach? We're able to personalize care, right? We're able to understand each part of that patient's pelvic floor. I'm able to use biological approach as well as technology to get this patient where I want them to. And surgery if I need to as well. So my name is Ramirez. I'm a board certified OBGYN, stopped delivering about 6 years ago. I now consider myself a cosmetic gynecologist. I do tummy tucks, breast augs, body contouring, a ton of pelvic floor rehab, a ton of labioplasties, and all those things. I'm also a trained urogynecologist. I have an integrative medicine fellow. Prior to going to medical school, I was an occupational therapist, and I was the one who developed the Aviva on this platform. So I know you guys have heard a lot, and you've got it already. The best way when I think about the whole entire platform, I think about it into 3 categories. Preventative, right? What does a preventative patient looks like? That patient comes into your clinic and she has no symptoms, she has no issues, but she's delivered a baby, and we know what's the percentage of people that have pelvic dysfunction 10, 20 years down the road after a baby? Almost nearing 70%. So before they have symptoms is a place that you're able to capture them to prevent them. So my number 1 category is prevention, and we're capable of doing this with this platform. My number 2 category is restorative, curative, right? So patients that have urge, stress, incontinence, dryness, laxity, loss of sensation, prolapse to grade 2. All those patients, recurrent BV, recurrent UTIs, lichen sclerosis, vaginismus, all those things that were hard to treat, we have an ability. Even my IC patients, that's very difficult to treat, I can keep away from pain longer with my Empower. And then, of course, rejuvenative, right? The ability of making things look better on the outside. On top of making things look better, we're able to tighten up the clitoral hood and improve the sensation of the clitoris. So we also improve function, sexual function. So the other thing that's important to know is that each one of these modalities are covering different tissues in the pelvic floor. There is not a platform out there that has that ability. You know, you either have mucosa alone, like a CO2, or you have EMS alone, right? Or you have radio frequency alone. We have EMS, form of E, and mucosa. So we're able to treat muscle, soft connective tissue, and mucosa. There's no other platform out there that's capable of doing that. So what is it, again, what's the percentage of people that have sexual dysfunction when they have pelvic floor dysfunction? 50% of the patients end up with that kind of dysfunction. And the problem is that's the way we started this whole presentation about let's talk about sex is what our patients are feeling. They're told, I mean, it's very taboo. They're told you shouldn't be talking about sex. You're a little bit freaky if you're talking about sex. So they don't bring these things up. So it's up to us in our clinics to be able to educate our patients. And our obstacle is getting out of the construct that you don't have anything to offer. Hopefully after today, after you listen to us, you understand there's plenty to offer them from this perspective. So what is radio frequency? Can we just do a hot stone and get the same results? Right? You just put a hot stone in there, massage it a little bit, we should get the same results as heat, right? The answer to that is no, it's not. The radio frequency is actually the lowest, the radio frequency we're using is the lowest terms in the electromagnetic field, right? We're with radio frequency vibrating the smallest molecules, hydrogen molecules in the tissue, and depending on how high that frequency is, how much energy, depends on how much that vibration is gonna be, whether you're gonna denature protein versus increase blood flow and metabolism, right? So on our form of E side, we're increasing metabolism, increasing blood vessel productions, as well as increasing blood flow and sensation. On the Morpheus side, at the tip of the Morpheus, we're causing denaturing, and we're causing tightening of that fibroreceptor network, as well as an improvement in fibroblasts, improve the amount of collagen and elastin that comes in. So understand that this radio frequency is not just heat. It's a vibration of that molecule that sends the signal for the fibroblast and the macrophage to come in. I think that's important. A lot of people don't understand that it's not just heat, it's an actual vibration that causes the beginning of this inflammatory response. So what are we doing? We're causing collagen activation, tissue regeneration, improved circulation, reduce inflammation, and increase elasticity. And those are just some vessels that we're producing. So if we know this, how do we improve sensation on the clitoris? We all are used to the O shot. The O shot is very popular. But what if you improve the response of an O shot by using radio frequency first? And that's what I call my FEM shot. So first, I use my form of E just as on the clitoris, and I'm heating it for about 10 minutes, taking it to about a temperature about 43 degrees Celsius, and that starts off that inflammatory response that improves blood flow to the clitoris, improves sensation. Once I'm done with that, a lot of the sensation issues with the clitoris has to do with thickening of the tissue, right? So the next thing that we do is that we resurface it with Morpheus. And I use a Morpheus 12 pin sometimes on that, depending on when I'm doing it. And then the other thing that's important is to tighten the hood and the labia minora around it so they have more friction. Once you're done with that, then you can do the PRP FEM shot. You guys, who's used to using O shots here? Are you combining it with radio frequency yet? That's key. So in the O shot, traditional O shot, the only mechanism of trauma is that needle going in, and that's what sends the signal, right? So what we're doing here is actually increasing the trauma with radio frequency, through Forma V and through Morpheus. Have you guys done Morpheus on the clitoris? You're gonna need to numb it. It's important. Don't do it without numbing it. And my energy here is not all that high. I'm going to like a 5 to 10 energy, and all I want to do is just cause the resurfacing on the very superficial edges of that. And then once we're done with that, then we inject. This, in my practice, improves clitoral cessation almost out to a year. And everyone in my practice, so that once they're done with their last treatments, there's 3 treatments that we do, once a month, every 4 to 6 weeks. Once they're done, they get lined up again for a year for another treatment, and they'll get a discount before they leave. That's how you keep them coming. And it's the same maintenance, just like patients that have their annual pap smears and all that good stuff. I know that's kind of changed, but just the same way, you got to keep your patients understanding that it's a maintenance. It's not forever. So again, then I'm very biased to this. On top of the Morpheus and stuff, I also get this type of results with my Viva training, with my Viva by tightening the hood and tightening the labials around it as well. So the Viva does a good job of tightening that tissue so they can have the friction during the sex that they need to have. So you heard us say that what we're doing is causing a trauma, organized trauma with a radio frequency, right? And then when we cause a trauma, we expect that the patients need to have the proper response, that they're gonna have everything they need to produce more blood cells, to produce more collagen, to produce more elastin. In our traditional medicine, we're taught that there's nothing else that we need to add because that patient's human. They're gonna be fine, their body's gonna heal. The truth is that there's a lot of patients that are missing a lot of these things, so you should consider all the wellness things that you do in your office and combine it with what you're doing. That, on top of giving you a bigger return of investment, that also introduces that patient to an overall wellness. So how do I do this? I considered 3 different categories: sleep, nutrition, and stress mitigation. Why are those categories important to me? When a patient's not sleeping properly, one of the things that they're not able to produce is HGH. If they're not producing HGH, then they're not able to produce the collagen and elastin to the optimal level that you want. So sleep is extremely important during those first 3 months, 6 months. So in my practice, I have a health coach. If they're not sleeping, they've tried everything else, I'm looking for a way of hacking them. In this world, you can hack HGH with peptides. For women, I love Samorelin if they're not sleeping well. So for 6 months, I'm thinking Samorelin. Okay, so that's at the sleep level. Also, nutritionally, when you think about nutrition, you think about cellular respiration, right? Why is cellular respiration important? Because you've caused a trauma. And in that trauma, those cells, immunological cells, have to chemotaxis to that area to produce the change. What does it take for those cells to be able to do that? Cellular respiration. That seems like a long time ago. The Krebs cycle, the electron chain, all of a sudden becomes important. So all those cofactors in the Krebs cycle and electron chain is important to consider for your patients. All the vitamins, all the minerals, NAD, make sure they hydrate, okay? Also, what is that patient, if you have a patient that's on weight loss and she's not eating properly, what could she be missing to produce collagen? Protein. So they need to be on some type of protein replacement, things like that, so that you can optimize the results and decrease the variability in it, okay? The other thing when you think about nutrition is, are people absorbing everything that they eat these days? They're not. The microbiome is super important to think of. So prebiotics, postbiotics, probiotics, all those things. You guys know the difference between post and prebiotics? Ask me afterwards, I'll tell you. Also, I use peptides to decrease leakage in the bowels and things like that, like oral BPC 157, that improves that absorption. The last category is going to be stress mitigation, probably the most important category of them all. Patients that are chronically stressed or chronically high on cortisol. If cortisol is high, the immune response is going to be limited. If the immune response is going to be limited, all these things that we're doing are going to be variable in results. okay? So we talk to our patients about getting out in nature, walking, exercise, meditating. Meditating is always a tricky spot in Oklahoma. If I mention meditating, they think I'm the devil. And I normally say, hey, this is not about religion. It's about really honing in on your own frequency. And it's training your brain to shut up for 10 minutes. You know, that psychic entropy that gets you thinking about the past or the people you hate or the future or how many patients you have on Monday. That guy, that's the person you need to shut up for 10 minutes so that you can decrease your cortisol. On top of making it quiet, you're also trying to get this patient to pay attention, to be present in that space. Because I believe presence is the beginning of purpose and creativity in their own way of healing. So we drive all of that. And when we're able to do that, and I've got plenty of patients, not all my patients sign up for this, but the ones that do, I got plenty of patients to show how much more they improve. And on top of that, how they continue being patients for a long period of time. The other things you can consider is hormone replacement, of course. If they're low on hormones, they need hormones. If you're treating the vagina, estrogen is almost always important. Think of your exosomes and PRPs, okay? So, with that being said, I really believe that in your clinics, you're better off, and your results are gonna be much better if you're thinking about sex to approach, and everything else that we do with radio frequencies, to approach that person holistically. To consider all the things that you can improve, that's in your control to improve in that patient so that the variability of results are less. That's the missing piece. If you're able to have a nice protocol where you're approaching patients that way, not only will you have very predictable results, you'll have patients that are happy with the results, and you've introduced them to healthy living for the first time because no one else has in my world. I have a master class that's on here. It goes over all the things that I talk about and I know in small little quick little videos. There's how you get to it. That's a promo code that's there to save you some money on it. When we get up here towards the end and we start answering questions, I welcome all the questions that you guys have on this. But the point is remember, you guys have all the things that you need in your office to combine things to improve your income as well as to improve your overall approach to your patients. Thank you for being patient. You're up, Nikki.